Hi, I'm Robert Nicholson, president of the ED Treatment Information Center. Today I'm talking with Jennifer Stephen, owner of Intimate Outcomes Coaching. Jennifer is an IPEX certified professional coach specializing in sex and intimacy, and she's going to have a lot to tell us about how she helps men and their partners. And I should mention that Jennifer is also the co-founder of the ED Treatment Information Center. Welcome, Jennifer.
Welcome, Robert. Thank you for having me. I'm very happy to be here with you today.
So, Jennifer, you're a sex coach or intimacy coach. What exactly is that?
So I get that question quite a bit. I am an intimacy coach and or a sex coach, whichever anyone in particular prefers to refer to me as. An intimacy coach is someone who helps an individual who comes to me and says, listen, I'm having difficulty approaching whatever specific issue it is they are having. So if they should come to me and having difficulty with, say, an ED issue, we specify and or figure out exactly what it is they want to get to the root of, and I help them figure out a way to overcome that issue. I would also like to take this opportunity to say that I'm not a therapist, I'm not a psychologist, I don't prescribe medications. I am wholly interested in my client's outcome. We don't delve into the past. I do not go into something that happened to them when they were 6 or 7. We don't do that. We are future based. So they're going to come to me with a problem that they're having right here and now, and we are going to look at that situation, and then we are going to come up with a plan to solve that problem.
So, what kind of issues do you deal with? In other words, when would a person say, I need a sex coach to help me deal with this issue?
I'm not sure that anyone ever says, I need a sex coach. That would be very, what's something that, no one ever really says. I think that we are, there's actually not very many of us, certainly not a lot that are certified. And that, let me just say right now, if you're looking for a sex coach or an intimacy coach, please try to find one that has been at the very least certified. Anyone can throw their shingle out there and say, I'm an intimacy coach, I'm a sex coach. Please try to find someone that is, at the very least, has been certified and has some kind of credentials. That's vastly important because you want somebody who's going to have the knowledge you need to get you where you want to be. So the issues that I do deal with erectile dysfunction, and I deal with it from a lot of different perspectives: medical, stress, anxiety. So there's different ways, of course, in which people have ED. It's not just a medical, as far as when I say medical, I meant, coming from the perspective of having cancer. I mean, it can be stress related, it can be obesity related, it can be, so you can have ED from many different kinds of perspectives. Um, I get a lot of people that come to me too because they simply don't know how to talk about sex. They don't know how to talk to their partners about sex. Or I get couples that will come to me, either the male. I do deal with a lot of men who don't know how to talk to their wives and say, listen, we've been together for 10, 15, 20 years, and there are things that I want to tell my partner or things I want to try, and I don't know how to do this without my partner looking at me as if, I'm an alien. And I don't want her to think badly of me because, of course, we've been having sex in the missionary position for 20 years now. And I would like to tell her I would like to do something a little different or try something a little different. So I get a lot of that as well. People just don't know how to talk about sex in an intimate way, and I can really help them to be able to express themselves either help them do it, or even they can bring their partners in and we can talk. And it's odd when they do that, how the female often will be like, "Oh my goodness, I really wanted to talk to you about this." So I deal with a lot of those kind of issues.
So you work with clients by phone or video chat, right? It's not necessarily in person in an office setting.
All of my clients are either by on phone or video chat. Yes,
Okay.
through Skype or any other means of video chat, whatever they feel comfortable with. Yes.
Okay. So obviously you're dealing with a lot of really sensitive issues. So what kind of training is required to be a sex coach and how did you get into this field?
All right. So I attend, as of right now, I attend Sex Coach U. That's my continued education. I did attend IPAC, which is a very well known coaching school. So IPAC doesn't specifically teach, pardon me, sex coaching. It's a little bit more varied than that, but they do teach you a lot of different things, which really set me on my path. And then I found Sex Coach U, which is a tremendous school run by a woman called Dr. Patty, who is just absolutely lovely. And um, the teaching that I get there has definitely helped me, opened me up to all of these sensitive issues in which I deal with. How I got into this field, I had a very interesting position that I held and still hold. And I was dealing with mostly men. I still deal with mostly men. And I found that most of what they were telling me was incredibly sensitive. And the problem was that they weren't being heard. They were talking, people were telling them they were listening to them, but nobody was really hearing what they were saying. And once I got past my own, female cognitive issues, I heard what they were saying, and it was fascinating. I was literally dumbfounded, my aha moment. And I thought to myself, this is incredible. These men really need to be heard and they really need someone to help them. And I just thought this is something I really would love to do for the rest of my life. I was very, very passionate about it. In honesty, in some of these sensitive issues, they just needed to be heard. And once they could tell you really heard what they were saying, everything was better for them. The improvement went from 25, 26% to 100. Just knowing that they were really and truly heard and understood, they were able to make those connections and to make improvements for themselves and to negate the fear and the insecurities. It was honestly some of the best moments I'd ever had in my life, to be able to do that for someone, and help them make those improvements in their lives.
That's amazing. So let's talk about erectile dysfunction. And we've found that ED causes all sorts of problems for men and their partners, like loss of self-esteem, anxiety, stress, communication issues, even depression. So can you talk a little bit about how you help men or couples deal with those issues that arise out of ED?
Well, absolutely. So the very first thing I do is I find out what is the cause of the ED for that particular person. So as you and I both know, ED is not the same for everyone. It can very well be a medical issue caused by cancer, obesity, diabetes, stress, depression. So you have to identify that first.
So you would refer them to a doctor to understand the cause before you start working with them.
Absolutely, because you certainly, if I have someone comes in and says, "Well, I have ED," I don't know the cause of that ED. I mean, ED will cause stress, anxiety, depression, and self-esteem issues for everyone.
Right.
Those are pretty blanket statements. I mean, for a man whose penis is not performing correctly in his image, the way he would like it to, yes, that's gonna play a huge role in all of those things. I mean, this is something that he's had with him his entire existence. It's no longer, doing what he would like it to do. And that is ego crushing. That is really the epitome of 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 what a man feels like makes him a man, correct?
As a man, I'd have to agree.
Yeah, so I mean, now all of a sudden it's not working. If I was a guy and my penis wasn't working, yeah, I'd have all of those issues too. But why is it not working? And so now we need to find out, are there any medical issues involved here? I am not a medical doctor. So, yes, that's one of the very first things I would ask. So, are you having erectile dysfunction, once a month? Is this a constant issue? So yes, I would definitely have, I have a form. I would ask you to fill this out. I would ask you to see your physician because your health is of vital importance. So yes, you need to have those things examined.
And then whatever the cause, you would then be dealing with the issues that arise from that.
Right. So, so say, you find out that you have prostate cancer. Now you're going to have to go through a great many things in prostate cancer. As you and I both know, urologists are wonderful and great. You find a great urologist when you feel comfortable with. You see your medical doctor, your urologist, your physicians, but many of them are not or do not have the training to help you with what occurs after you've taken care of the problem,
Right,
right?
right,
So you've gone through all the medical procedures, you've removed any cancer or cancerous like issues, and you found out that you could possibly have erectile dysfunction forever.
right.
Devastating,
Yeah,
right?
yeah,
And there's no one to help you with that afterwards. I mean, who do you talk to about that? Your urologist is not going to be your therapist. So and you can talk to a therapist, you can talk to a psychologist, or you could talk to someone like myself who does deal with this on a daily basis, who does understand it, and who can help take the steps and the measures that someone in that particular situation needs to know that they can and will and should have a happy, healthy, fulfilling sex life. That is still possible to have an orgasm without an erection. That is still possible to fulfill your partner without an erect penis, right? But
right,
these are not things your urologist is really going to, he might, touch the subject briefly. He can give you some information on things that you can do, the shots, the pumps, the pills, and those things, but he's not going to be there with you really long term to give you what you need because it takes about a year, right? And as you well know, to overcome a lot of that
right,
and
right,
to get into the place you need, right? But you're not going to wake up with an erection the next day, maybe, and can you maintain and get some kind of an erection? Absolutely, it's possible to some degree, but it's probably most likely not going to happen. And that's honest, right? So you need to change your train of thought and think, okay, what can I do? You can still have an amazing internal orgasm that is deep and sensual and erotic and maintain your sexuality. And that's an important thing to know and understand. It does not, a man, getting and maintaining an erection does not take away from him as a man.
right, right.
And that's something men need to know.
So you've talked about dealing with the man. I know sometimes in your sex coaching practice, sometimes you're working with a man, and sometimes you're dealing with his partner as well. And does that change your focus or the approach that you take?
I don't think it necessarily changes what I say to the man. I think what it does is that it helps for them to work together. So many times the man becomes, to be honest, despondent for a time. I mean, let's just be realistic. Young men begin masturbating typically at a young age. They are very intimate with their penises. They've been masturbating for some time. It's very true. And so if I'm too blunt for some, I apologize, but this is just who I am as a coach and the honesty that I bring forth. Men begin masturbating. It's very sexual. It's very erotic. It's very pleasing. So, and then they've been doing this from a very young age, maybe 11, 12, 13. It's very stimulating. And now all of a sudden, even masturbating is not bringing them pleasure because they're not becoming erect. And now you mix that together with your partner, right? And now you can't become intimate with your partner. So now I'm not getting erect. I'm not able to orgasm. And mind you, not only are you not orgasming, but you don't produce semen. So that's another thing. You're not producing semen. And that semen, for some men, is the end all and be all
Right.
of your orgasm, right? They don't realize that the semen, you can have an orgasm, you don't need semen. So that semen is like, ooh, that's the big woo-hoo, right? That's the party favor. And now you've got this, your partner, and you feel like, how am I going to please my partner? And she's been trying to hopefully, assure you that this is not the end all and be all. There's other things we can do. But if she hasn't been doing that, that's where I come in. And we work together and, we discuss things such as, strap ons. We discuss things such as oral sex. We discuss things simply holding hands, being intimate with one another and talking about the things that you've done in the past that arouse one another. I mean, do you remember the way you would look at one another and feel that sexual tension and be excited about what was going to happen later on in the evening? And how can you bring that back into your relationship, but know that play is going to be a little bit different? And that oral pleasure is still it's very much in the realm of possibilities because even though a man doesn't get erect, he still has a great deal of sensation in the area and it still feels wonderful and can stimulate an orgasm. So all of these things, people are afraid to broach those subjects because it's no longer erect. They think just because the penis is no longer erect, it's not viable. And I have to assure them that it's very much still viable.
And it sounds like a lot of what you're doing is helping with communication because that's one of the things that we hear from partners of men with ED. It's not so much that they miss the sex, it's that they miss the intimacy and the connection. And that's something that you help to foster, right?
Absolutely, because and that's what I'm helping them do to communicate about these things. Because again, the penis becomes off subject. It's like the great white elephant in the middle of the room because we can't talk about it because it's the problem, right? And if we talk about it, then it becomes real, and I need them to communicate about it. I need them to be open about it and say, okay, yes, this is part of the issue, but there's other things. And let's communicate about that. I love it when you hold my hand. I love it when you look at me. I love it when you touch me this way. And your penis is not the end all and be all of everything. And I want to be able to hug you and kiss you and touch you. I love the way you look at me. I love, whatever it is they need to say to one another. And to be able to communicate that with one another is of vital importance. But they have to keep the communication open in order for that to be successful. And women, again, tend to take it upon themselves as if they've done something wrong or it's their fault. and they don't allow the men to heal, to be honest with you, to kind of, in all honesty, wallow in a little bit of self pity. It's okay for men to feel badly for a little while, but then they have to kind of pick up and move on as well too. And say, okay, you know what? I get that this isn't what I had planned in my life, but here's where I'm at. Now, what can I do to move forward and make the very best out of this situation? Like we do with all things in life, right? I mean, it's just the way that works. And so, but there's no saying that you can't feel badly about something for a little while and then move forward from that. But women can't mother them. And they don't want a mother. They want a wife. They want a sexual partner. They want someone to be intimate with. Don't mother them. They've had mothers or have mothers. They want a partner. And that's what they need and want. They still want to feel sexy, and they still want to feel wanted, and they still want to feel like they're viable. And we need to remember that and go forth with that.
So it sounds like this is the kind of thing where this would benefit a lot of men and a lot of couples tremendously in dealing with ED. And it sounds like you're the kind of coach that these people really need. Is there anything else that you'd like to share about sex coaching?
I do deal with ED quite a bit, but I also want everyone to know that I do deal with other things. And I deal with ED, I deal with other issues. Um, I have a lot of cross gender people. I deal with a lot of cross dressing. I deal with a lot of BDSM issues. But there are a lot of sex coaches who deal with all of those issues too. So find a sex coach that either will work with you in your particular issue. Make sure you find a sex coach that you feel comfortable with, that is qualified, that has credentials. Please, 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 please make sure you find a coach that has your agenda in mind. There should never be a coach that is saying, this is what I want you to do, this is how it should be.
Right.
It is always about you, what you feel is best for you and your agenda.
So coaching is really about, and coaching of any kind, not just sex coaching, but part of what you're trained to do is to listen, to help people figure out their agenda, and then help them figure out how to get there. So as you said right at the start, the work that you do is very outcome oriented.
Absolutely. Absolutely. It is never about your coach. It is always about you and helping you to achieve your ultimate outcome, whether it be whether it be to have, whether it be for you to put on a dress and go out in public, whether it be for you to have sex with your partner, whether it be for you to be comfortable coming out to society, whatever it is, your agenda.
Great.
That's the kind of coach I want you to have. That's the kind of coach you should be looking for. That's ultimately what it should be. So that's what I wish for you all when you look for a coach.
All right. Well, thank you, Jennifer. So if men would like to reach out to you for help, how can they contact you?
I am at intimateoutcomes.com. I have a website, and I believe there's a way to contact me there.
Yes, you have your phone number and a contact form on the website.
Yes, I do.
Okay. Thanks very much, Jennifer.
It was a pleasure. Have a wonderful day.
All right. Bye-bye.
Bye-bye.